Hi, my name is Sandipan Dasgupta. I come from India. I did my undergrad at Indian Institute of Science, Education and Research, Kolkata, following which I started my PhD at the Weizmann Institute of Science, where I'm doing my graduate research in the laboratory of Professor Jeffrey Gerst at the Department of Molecular Genetics at Weizmann Institute. I'm also a founder at the Weizmann Biotech Club, which is one of the largest professional forums for PhD students and postdocs who are interested to explore the biopharma industry in Israel. Recently, I've also been involved with the coronavirus testing facility here in Israel at the Israel National Center for Precision Medicine at Weizmann Institute of Science. It's great. It feels really amazing for the fact that most of my regular research is bench-based, so I do a lot of molecular biology work at the basic science level. But working in a testing facility here makes me feel especially valued that my skills can be directly used for public good and public health directly, and it feels my skills and my research extremely valuable, which is once in a while good. So I have an experience of volunteering at the facility at the Israel National Center for Precision Medicine, which is at the Weizmann Institute of Science. And I can say with much conviction that the facility here is one of the top of the line facilities that you can find across anywhere of the world. It's a completely automated facility. So most of the work is actually done by robots and automation. So there is a very minimal chances of cross-contamination, false positives or false negatives. Although once in a while we still encounter them, but as a by and large, it's a very precision system. Most of the manual work goes in preparing the sample and not just testing the sample. I've also actually written an article about how a testing facility actually looks like and what are the operations that are involved. We can also probably link the article in the description. Can totally sympathize with the feeling because for the fact that I am also a PhD, and also it feels once in a while that my research is probably not going to benefit someone directly tomorrow or day after tomorrow or even next year as well. It's probably extremely long-term process. But again, unlike medicine, science is not a utilitarian practice. It's rather an exploratory practice. So you have to be curious about asking the right questions without directly bothering about whether or not it can directly help someone tomorrow or not. Think about that, like how coronavirus is being tested these days by using a process for reverse transcription and PCR. So decades back, probably there was some graduate student who was curious about to understand how RNA viruses actually infect cells, following which they discovered something called the reverse transcription, and following which we're in a position now to actually test this virus. So the root of science is curiosity, and probably that's going to be the way even if the pandemic is over. The questions that you are curious about now is probably going to answer much larger questions tomorrow and the coming future. This is a very interesting question. I think one of the biggest aspects of this coronavirus pandemic, which is otherwise extremely tragic, is the changing nature of research collaborations. I can see around myself that a lot of researchers spanning from different disciplines of science, maybe it's medicine, basic science, molecular biology, people from the mathematics and the computer science backgrounds, they're actually collaborating on a scale that is rather unprecedented and something which is also on a very fast time scale. As a result, people have been able to turn out results on a much shorter time scale than what it usually takes to research. So I would say in terms of research collaborations, this chapter maybe is a black chapter in human history, but it's a very I would say very important watershed moment when it comes to research collaborations going forward. As I said just now, that this epidemic or this pandemic is a watershed moment in terms of biological research. People are actually going to put more faith and more belief in scientists like us who are actually dealing with biological research. And we probably have a more important responsibility coming up in the future, trying to predict what kind of pathogens or what kind of infections can possibly come up in the future, and possibly try to arm ourselves beforehand before it takes a lot of lives and before we feel helpless. So more than anything else, I believe that this pandemic is more of a test of our patience. We are very sure that it will going to end at some point. It's just when, as scientists, we are trying our best to figure out how this virus works and to probably make it go away as soon as possible. But it probably might not work overnight. So we might need a few more days to come with the right strategy to fight this virus. So the biggest thing that you can do as of now is be patient and wait till we come up something credible to fight this virus.